Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing, weekly briefing for Tuesday, October the 19th, 2021. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Dr. Henry has a presentation to make with respect to COVID-19 in BC and a situation report on K-12 schools, and I'll be back to report on some of our my regular weekly items as well. With that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So we're here this afternoon to share the latest updates on our COVID-19 public health response, and I want to start by just acknowledging, as you might have seen earlier today, I announced changes to the Provincial Health Officer Order, which lifts the capacity limits at some of the organized events and gatherings with the implementation of the vaccination card and the checking of full vaccine status. So effective October 25th, one day after the full vaccine requirement comes into effect, we'll be able to increase to 100 capacity at indoor sporting events, indoor concerts, theaters, movie theaters, dance and symphony events, and some of the great arts and sports that we've been missing, as well as indoor organized events such as weddings, funeral receptions, and parties. I will, as well, we're going to be lifting that restriction, the requirement that everybody be seated at restaurants and pubs to allow a little bit more freedom of movement with the fact that everybody in those situations will be fully vaccinated. I will remind people, of course, that the other public health restrictions remain in place, including the indoor mask requirement when you're moving about. And these changes are applicable where proof of vaccine status is being checked, and also where there are no regional health orders in place. And as you know, we've been monitoring that very carefully, and regional orders are in place in some areas in Northern Health, Interior Health, and Fraser East, for example. So we're hoping to leverage the benefits of the vaccine card, and this is an important first step of that, and we'll be monitoring carefully and looking at whether we can take away additional restrictions depending on how things evolve over the next few weeks. In addition to the changes this morning, I want to share today our first school situation report. As we talked about a number of weeks ago, we've been trying to collate information in a more systematic way than we were able to do last year, and to be able to provide that information on a monthly basis so people have a good sense of what's happening in our schools. So this first report looks at the impact of COVID-19 on children and K-12 schools. It will be posted after the briefing today on the BC CDC website, and there's quite a bit more detail in it, so I encourage people to go there. And we will have additional reports released on a monthly basis. And as we are able to collect more information and get the systems in place to put this together, we'll have more information available as well. But first off, I wanted to start with looking at presenting the update of the age-based cases that we've seen. So this is the rate of in the 12 to 17-year-olds, particularly in the areas where their vaccination is high in that age group. One of the things that we want to do is look at those case rates and see the impact of where people are being infected. So we look at the age, we look at where the geography, as well as what's happening in the communities around those schools. And as we can see across BC, we've seen a decrease in young children and the school-age children as well across BC, but particularly this has been pronounced in Interior Health and Northern Health, where we saw the biggest increases. And certainly at the beginning of the school year, it was a dramatic increase in interior health that we were seeing primarily, again related to the increase we were seeing in community across interior health that started in August. And that's now taking a downturn. Northern Health continues to remain higher than in other parts of the province, but we know that that is a reflection again of what we are seeing in communities across the north, and reasons why we brought in additional measures in much of the north last week. We do see, however, that those rates remain stable in the vaccinated population and the 12 to 17-year-olds, and they remain low in the areas where we have very high immunization rates in families and communities, particularly Vancouver Coastal and Island Health. So this gives you a good sense of where we are now. This tells the picture a little bit of what we're seeing and why we're seeing this. So what it shows in the light blue line is the percent positivity, the 7-day moving average of daily test positivity in the different age groups. And the darker blue line tells you the rate of tests. So this is a summary of some of the information I presented a few weeks ago, which showed that we had a dramatic increase in number of tests being done, particularly in school-age kids, but also in younger children 0 to 4. And this reflects people coming together again and going back to school, but it also reflects that we're starting to see other respiratory viruses causing infection in children and in communities, and that's adenoviruses, some enteroviruses that cause respiratory infections, a little bit of parainfluenza. We have not yet seen a lot of influenza, but we did have our first influenza positive in quite some time just this week. So we'll be carefully watching that. But what this shows us is that across the board we had an increase in rates of testing in this age group, and we had a steady decrease in the percent positivity. So it is telling us that we're looking for this in younger people, and we're finding it, and those rates have now come down. One of the other things, of course, we're very concerned about is, are we seeing severe illness in children? And we've been watching what's happened in other countries, particularly the US, where there was a dramatic increase in hospitalization in school-age children. We have not, thankfully, seen that here in BC, but we will continue to watch. We have seen very few children admitted to hospital, thankfully. In the past week, we have had one admission So we've had 5 new admissions in the 0 to 4 age group, 1 in the 5 to 11 age group, and 1 person 12 to 17 who were admitted to hospital. And there were no admissions in the school-age children to ICU in the past week. So that's important for us to watch as well. Again, in the areas where we have children who are immunized, the 12 to 17 age group, we can see that hospitalization is much, much less common, even though it's rare across the board, less common in youth who have at least 1 dose of vaccine compared to unvaccinated young people. Again, this is something that is important for us to consider now that we know that Pfizer has submitted the complete package to Health Canada for approval in younger children. And it reminds us again the importance of protection of children from a transmission, not only to prevent hospitalization, but to prevent that transmission of disease in these important settings. Finally, in the report, what you'll see is a more in-depth analysis of the clusters we are seeing in schools, particularly in the interior health region, where we had those high rates of transmission in the community, and we saw the most increase in child age infections. And so there were 80 clusters where COVID transmission may have occurred in the school setting during the first 5 weeks of the school year this year. So a total of 314 cases were linked to these clusters, which is about a quarter of the cases among that age group of children in the region. And a cluster, as we've defined it, is 2 or more cases within a 14 period of time. And so there were 12%, 46 schools in the interior health region where a cluster was reported. And importantly, we look at how much transmission is happening, because we want to compare that this year to what we were seeing in the last school year. And the data that is in the report that you can see from last year, on average we had, or the median number of people that were involved in a cluster was 1 to 2 last year, and we are seeing a slight increase this year where the median number is 3. But it is still remains small, and across the board in the province, less than 1/3 of schools have had a cluster. And I think that's important. We can see that these are always stressful situations, and we know there was a lot of anxiety going back into school this year, and it's important for us to provide this information as best we can so people know the situation that's happening. So what we can see is that across the board, the number of schools affected have been about 1/3, which is about the same as what we saw last year. And there is slightly increased transmission, but it's mostly controlled. And again, most of the infections, the source of infection for school-age children is outside of the classroom. Obviously, we need to continue to watch this, and my colleagues across the province are working with our schools, with our educators, with the teams to make sure that we can get as much information as quickly as possible to parents. I will say again that we know it takes time to do those case investigations, and that parents are often the first who know if their child is ill. And so we need to work together to make sure we're taking all of those precautions so that we can keep our schools active and functioning and all the important things for children in the school system this year. The other, of course, things that we've been in terms of vaccines that we've been working on this week, we have a few encouraging updates. We've been monitoring, again, the outbreaks and cases in long-term care facilities as we've started to roll out the booster doses in those settings. Again, we see that they reflect the community rates of transmission. The measures that we've put in place, including prioritizing that third dose for residents, just as we did with COVID vaccines the first time around, to ensure that our most vulnerable have that maximum protection. And we've started with those facilities where there is a risk, where we've seen a person, either a staff person or a resident as a case, and also prioritize those facilities that started early and had the reduced interval to make sure that we can provide protection as quickly as possible. And our teams are working hard to get those doses into arms as soon as possible. I will say the other part that we have around our long-term care, as we know, in a week now since the requirement for workers in health in long-term care and assisted living to be vaccinated, and that is going very well. It's that extra layer of protection. But we've also recognized the importance of upping the infection control precautions that are being taken, even with that fully vaccinated population, knowing that everybody needs to take these measures right now so that our seniors and elders in care can be as protected as possible. Having said that, we are also looking at where other booster doses might be needed in our community for those who are most vulnerable, and we'll have more to say about that later on this week. In addition to encouraging everyone to get their COVID-19 vaccine, today marks the official public launch of our influenza immunization program. And we know last winter, despite the challenges with COVID-19, we had very few, actually no active cases of influenza from outside. We did have a few influenza swabs that tested positive, but they were mostly from young people who received the active vaccine. So that is good. And partly that was because of our high level of immunization, as well as the fact there were many public health restrictions in place through that winter season, which limited our ability to move around and spread, and particularly international travel restrictions, which we know is one of the ways influenza spreads around the world. This year is a different situation. Not only are we needing to take precautions because of how easy this new Delta strain spreads, but the BC vaccine card also allows us to spend more time with others, and we know that some of the international travel is coming back. I'm strongly encouraging everyone in BC this year to be immunized against influenza as a way of protecting yourself from this other serious respiratory infection, but also reducing the respiratory transmission risk in our community so that we are taking that burden off our healthcare system as well. And this year, the influenza vaccine is available for free for anybody over 6 months of age for whom it's recommended, but particularly people who have underlying health conditions or who work with and care for people who have compromised immune systems or underlying health conditions. It's most important that you protect yourself and them from influenza as well this year. As anticipated, we've seen once again the recent announcement from the United States that when it comes to international acceptance of what's considered fully immunized, the situation continues to evolve and quite quickly. But I was very pleased to see the U.S. is now in step in recognizing the approach we've taken here in Canada, and is accepting all of the mixed doses that we've had here, including AstraZeneca and different mRNA doses. And I think it's a credit to the work that we've done here in Canada to show the effectiveness of these vaccine combinations. And I'm just very pleased. That means people in BC who are fully immunized will now be able to travel to our neighbor in the south as well. It is further evidence, of course, that all of the available vaccines approved for use here in Canada are safe and highly effective, no matter what combination you've received. So I think that's very encouraging news that that's starting to be recognized more internationally. The one other thing I wanted to address today is questions that I continue to get about post-infection immunity. And really, the bottom line is from scientists around the world that there is no consensus yet, as we're learning about this virus, on the strength and durability of post-infection immunity. And there's no good way to measure that strength and durability over time. Yes, we do absolutely recognize that most people have some immunity for some period of time after being infected. And early on, when we had limited supplies of vaccine, we didn't prioritize people who had a recent infection within 3 months because we knew that most of them had some degree of protection against this virus. But we've also seen studies that have shown that that protection can be very variable depending on the type of infection you had, depending on your own strength of your immune system. And there have been some small studies that have showed that some people do have very long and durable protection post-infection. However, it's impossible to prove how strong and how long this protection lasts in individuals over time. And because we cannot know that, and we do see people having repeated infections that can lead to serious illness and hospitalization, that we are erring on the side of the protection with the known amount of antigen that is in a vaccine. So that gives the most prudent response to be able to protect people with a known amount, with a known period of time. So again, for people who have had a previous COVID infection, it is still recommended that you receive a full dose, a full series of any of the vaccines that are approved for use here in Canada. So every week we do stand here before you to provide you with the latest updates, the latest research and information that we have, and every week we have lots to share. This is because we are seeing that this pandemic continues to evolve. And we are trying to evolve as best we can to support the needs that people have so that we can do the things that we need to do to protect our friends, our colleagues, our neighbors, our loved ones, and continue to try and live our lives within the context of the pandemic that we are managing right now. Here in BC, people have faced this storm with compassion and determination. And even though we know that things are not as where we want them to be right now, we know that the vaccine is giving us good, strong protection, and we can see that in the results. That we can see that in our ability to get back to doing those things we love with the other people who are also protected. And we need to ensure that we're working for each other and doing our part that benefits everybody. So thank you very much for that, and I'll turn it over to Minister Dix.
Thank you very much, Dr. Henry. Throughout this pandemic, all of us have been taking steps to keep our communities safe. And this fall, there's another step everyone can take to stay healthy, protect our healthcare system, support healthcare workers, support one another. And that step is to book an appointment to get an influenza vaccine. I'm happy to share that every person over 6 months of age has the option to get a flu vaccine free of charge. That reflects our determination to have the largest influenza flu vaccine effort in British Columbia's history. 2 years ago, and in previous years, British Columbia received about 1.5 million doses of vaccine. This year, the number will be 2.4 million. That's 200,000 more than last year when we got extra doses. And that reflects the need right now, to ensure that we are protected, and as protected as possible as a community, from respiratory illness this fall. But the challenge of COVID-19 is significant, and we want to reduce other challenges the healthcare system faces. That's important. But as well, we want you to stay healthy and to stay fit throughout this winter, coming fall, winter, and spring. It's more important to take these steps than ever. You can get your flu shot by contacting your local pharmacy, your primary care provider, through a public health unit, or through other health facilities. Last year, pharmacies did a record number of flu shots. For the first time, I believe the majority of influenza shots took place in community pharmacy last year. I think it was in the neighborhood of 1.1 million of the doses that we delivered last year, which was roughly 1.5, 1.6 million. And I expect that to be the same this year. I believe 800,000 doses are out with pharmacy right now and out in the community. And so it's time to book. It's time to get your shots. We know that vaccines, flu vaccines and COVID-19 vaccines, provide protection to the wider community. And that's why as well, and this has been at the foundation of our strategy. As you know, yesterday, because we provide this information regularly, 88% of people in critical care due to COVID-19 were people who are not fully vaccinated. This represents a small share of the overall population. It's over 16%. That's how this group is. But the dramatic share of critical care cases and of hospitalizations. The data shows that unvaccinated people are 40 times more likely to end up hospitalized due to COVID-19 than people who are vaccinated. 40 times. The impact of the number of people in our hospitals with COVID-19, the overwhelming majority of whom are unvaccinated, can be seen with the number of people needing to be transferred, for example, out of Northern Health right now. Since September the 5th, a total of 65 patients in critical condition have been transferred to other regions of the province. That continues to test our healthcare system everywhere. It demonstrates how we're all in for one another during this pandemic, but it also shows the need for all of us now to get vaccinated against COVID-19 and join the 89.2% of people who've received their first dose immunization over 12 from COVID-19, and to get vaccinated a second, join the almost 84% of people who are fully vaccinated, and to do that as soon as possible. On Tuesdays, we report on the continued postponement of some surgeries in some locations in BC. Each and every person who has their surgery postponed will be called to rebook their surgery. That has always been our commitment, and will continue to be a commitment that is fulfilled. Your surgery is important, and we will get you your surgery. The news from Interior Health that it has started to call patients to rebook their surgeries is exactly what it should be. Encouraging and welcome news that restores us all, and for patients a phone call that reduces unwanted anxiety and allows considerations of the next step in their health progress and experience. I want to report that on the surgical postponements over the past 2 weeks, that's October 3rd to October 16th. During that reporting period, health authorities postponed 556 non-urgent elective surgeries or scheduled surgeries. That's 15 in Fraser Health, 177 in Northern Health, that's 107, 127 in Vancouver Coastal Health, 307 in Vancouver Island Health. No surgeries were postponed in Interior Health or the Provincial Health Services Authority. From September 5th to October 16th, there have been 1,940 surgical postponements over that period as we add the numbers up through week onto week of reporting. That said, surgeries are continuing across the province. From September 19th to October 2nd, health authorities report 12,084 surgeries were completed. This reporting period would be less. It's less than we would ordinarily see in the period, as it includes the health authorities' observance of the National Day for Truth and Reconciliation. For those who deliver surgeries to do the work we're counting on them to do, we know they're counting on us to do the essential work to stop the spread. Get vaccinated, stay safe. When it comes to contact tracing in BC, there are now 1,522 contact tracing staff in place across 5 regional health authorities and the Provincial Health Services Authority as of October 18th. 83 more were added over the past week. That's 507 in Fraser Health, 204 in Interior Health, 208 in Northern Health, 205 in Vancouver Coastal Health, 143 in Vancouver Island Health, and 255 in the Provincial Health Services Authority. Getting through the pandemic has always been a team effort, and all of those individuals, all of them, have demonstrated their commitment. I wanted and are doing, I think, remarkable work in supporting people at a difficult moment, especially when their COVID test comes back positive. I want to report on a couple of other issues to you. First is hospital bed occupancy, to give you a sense of where we are. On our base occupancy right now, base bed occupancy rate is 95.1%. That means there are 449 vacant base beds on a total of 9,229 base beds. Our total surge bed occupancy, as you recall, the total surge beds is 2,353. Our vacant surge beds are 1,856. So roughly 9,280, roughly is the current total census across BC hospitals. In terms of critical care, as you recall, we have 510 total base beds in critical care across British Columbia. At present, 55 of those base beds are vacant. We have added 218 total surge beds to critical care in BC. 183 of those are vacant. And so if you look at that, it's our total census in terms of critical care, all things, this is COVID-19 and everything else, is 490 as of yesterday evening. And I wanted to report on one last thing, and it's an important thing that's coming up. Dr. Henry talked about the significant effort to vaccinate staff in long-term care and in assisted living. As we reported last week, 96% of staff had been at least partially vaccinated in long-term care, 97% in assisted living. We have the preliminary numbers for health authority healthcare workers across the system. These are excluding long-term care and assisted living staff. And if you look across the system, so this is based on a unique count of 129,924. Of the number, 121,048 are fully vaccinated. That's 93%. 3,364 are partially vaccinated. And 4%, or 5,512, are not vaccinated. So we're hopeful, of course, that people will move to get vaccinated and comply with the upcoming order with respect to ensuring that everybody in our healthcare system, everywhere in our hospital system, all of our direct care staff working for health authorities are vaccinated. Those are the numbers, those are the relevant numbers for them. If you look at it by health authority, just to give you a sense, and I'll just give you the not vaccinated, I'm sure we'll provide this information to all of you as well. By health authorities, it's 2% not vaccinated in Fraser Health, 7% not vaccinated in Interior Health, 6% not vaccinated in Northern Health, 3% in the Provincial Health Services Authority, 3% in Vancouver Coastal Health, and 5% in the Vancouver Island Health Authority. So essentially what we're seeing, that 6% mark, is a very similar number to what we saw in assisted living and in long-term care. I want to thank each and every one of us who's taken that option, who have joined the path of getting vaccinated, of reducing transmission, and of getting back to the things that we love to do together. I think the effort by everybody in the healthcare system is all in right now. all in for regions that are struggling more with COVID-19 transmission right now, all in for everybody. And I ask everybody to do everything they can, especially when you're asked to get vaccinated, and that's everybody right now except those under 12, and to encourage and support one another as we deal with the COVID-19 pandemic in BC. We're happy to take your questions.
Thank you. A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question goes to Richard Zussman, Global News.
I'd like to ask first about the data at schools. Is this an acknowledgement that the mask policy in schools worked, considering we see the drop-off around the same time it came into place? Was the province too slow to put that in place? But also considering we've seen a drop-off in numbers, should we, when school districts are asking you for advice about what they should do about mandates for staff in a school setting, Dr. Henry, what advice are you giving them about mandates of vaccine within the school system?
Yeah, so if we look at masks, and one of the reasons we broke it down by those different age groups, so 5 to 8 and 9 to 11, because we have a mask mandate from the very beginning, from last June, for the 9 to 11 and above. And we don't see a significant difference in both the increase or the decrease in those two different age groups. So I do believe masks are important. I've said that many times in certain environments, and yes, it is important, particularly when you're moving around people that outside the classroom, etc. So it is one of the important tools, but it does tell us that the other measures we have in place are also important in the schools. And if we look at the rates in the adults in the school system and the 12 to 17-year-olds in the school system, again, we see that there's less transmission the more young people and staff who are immunized. I think there are a number of different considerations that school districts have, and there's been a lot of work with the team to provide a rational advice to school districts. And yes, I do think it's important that we get as high immunization rates as possible, because we know how disruptive it is to both education and growth and wellness for children and for families if schools are disrupted. So schools can be disrupted for a number of reasons. We have seen, and we continue to see, that it's very rarely related to widespread outbreaks, but it can be related to transmission or staff being off ill or having to isolate. So those are considerations that school boards have to make, and we are looking at all of the different aspects and options that they have for staff across the province.
Richard, do you have a follow-up?
Can you explain to me what data you're seeing to give you confidence to go to 100% capacity for these indoor events? Have we just not been seeing transmission when the vaccine card is needed? Also hoping for clarification. I understand you've removed the limits around people being able to get up and move around, but are people allowed to dance in that regard? And then also, could you provide an update on how many people have died that are fully immunized? That's one of the stats we don't get. And do we know of the death numbers, how many of those people are fully immunized? Thank you.
Yeah, so I can start with the last one. I don't have the number off the top of my head. It is part of the data that we present in the BC CDC surveillance deck that comes out on weekly. It has a table that tells you exactly how many and by what age group. We have had deaths in vaccinated, partially vaccinated, and unvaccinated people. So it does vary, and it varies. It reflects, of course, being in long-term care homes, where we see that the virus can spread very rapidly, and there's a very high rate of immunization in older people, our seniors and elders in care in long-term care homes. And tragically, that's a large proportion of the deaths that we've seen recently, older people who are in long-term care. And we count a death in a long-term care home during an outbreak if somebody dies, even if they don't have symptoms of COVID. We know that there are asymptomatic infections in people, particularly if they've been vaccinated. But if it occurs within 30 days, then it is counted. So that information is available. I can get it to you afterwards. In terms of the restrictions, we had always intended to lift the capacity restrictions in these seated events. So the hockey game, the theatre, movie theatres, once we got to the point where it was only fully vaccinated people who were in those settings. So it doesn't reduce the risk to zero. It means that we are mitigating the risk. We know that the risk of people who are fully vaccinated transmitting the virus and getting sick is much, much less. So that reduces the risk enough that we are confident we can, when we get to that point, have more people in those environments. And the restrictions on movements was one of the things that we've heard from restaurants and pubs particularly, that it's a challenge for them to stop people from talking to a neighbor at another table, and that can lead to challenges for staff who are already bearing the brunt of who don't like the concept of the vaccine card. So we are not seeing transmission in those settings where the vaccine card is used, where people are checking vaccine status. So again, it's another one of those things that we follow the data, that we are hoping to make it a little easier for restaurants and pubs in that respect. It doesn't go to as far as having lots of people together dancing, and I hate to say it, but so other settings that we are not yet at the point where we think we can get back to some of the normal activities, and I know it's going to be hardest particularly for nightclubs and some of the bars where this is an important part of the atmosphere in those settings. We are absolutely continuing to monitor. Right now, our health system is stretched. We know that the hospitalizations are high with COVID, and some of that is supporting areas of the province where immunization rates are still not high enough to stop that transmission, that rapid transmission to people, and we are seeing high rates of hospitalization still. So yes, we are watching that carefully, and I hope to be able to take off more restrictions as we get through the next few months, but it's going to be a challenge for all of us, and I just encourage people, for those over 85%, almost 90% of people now who are vaccinated, go out and support your local restaurant, your local pub. Use your vaccine card, go to the theatre, go back to the arts. It's important for those groups to be able to have shows where we can have people safely sitting. And I will also remind people that the mask requirements for indoor settings like these are still in place.
For the next question, we go to Shannon Patterson, CTV.
Oh, hi. I'd love to hear from both of you guys on this. There has just been an injunction filed in BC Supreme Court to try to force Raleigh's restaurant in Hope to, shut down or follow health orders. Dr. Henry, first of all, I'd just love to hear your reaction to that whole drama that has played out there with this restaurant that has thumbed its nose at the law. And Minister Dix, why has this taken so long? I think people have been super frustrated to hear they've only been fined $100 a day while they've been ignoring the order with no business license and no liquor license. So I'd just like both of your reaction on that.
Yeah, this is somebody who, a facility or a restaurant that's been defying this for some time. They've hosted political parties that are anti-vaccine, and it's been a difficult challenge. We're trying to do a measured response to these things. And Fraser Health has been, our environmental health officers have been working with the restaurant, have been making sure they absolutely are clear on the requirements are, and as you say, they have been actively resisting, and there was a group of business leaders in Hope, the community, the business association are all very upset about the impact of this type of defiance on their communities. And we did serve them with a closure order, along with pulling their liquor license as well as their business license. And the next step, of course, is enforcement, and we need the support of the courts, hopefully, to uphold that. We're trying to balance the need for public safety and making sure that we don't put our teams at risk. I know some of them have had some challenges in dealing with the restaurant and people in the restaurant. So we don't want to create a situation where things are not safe, but we recognize that these are not ideal. Clearly, it shows people that they don't respect their neighbors, they don't respect their business neighbors, they don't respect their community, and that is something that we are hoping that we'll get an injunction to help support us in closing.
As Dr. Henry has outlined, there's been a progressive approach to dealing with this restaurant and with others. And now we are at the injunction phase. And of course, we're disappointed to be at this phase because health authorities, as you can imagine, are unbelievably busy, especially our largest health authority, the Fraser Health Authority. And as you know, there are measures in place in the Eastern Fraser Valley right now because of high case counts of COVID-19. So you bet I understand that businesses and communities are frustrated when the vaccine card, which has been overwhelmingly taken up by, we're going to close in on, I think it's 3.7 million people have got their card and are supporting this measure, and is a necessary measure to allow us to have things such as sit-down restaurant meals in a difficult and challenging time of pandemic. I understand that frustration. We go through a legal process in each case, but I have to tell you that it would be my expectation, although that this approach will be used by other health authorities as well, if necessary. What has been successful in many cases is engaging with, for example, restaurant owners, but other business owners, and we've seen that work in a number of cases. And obviously, it's preferable to seeking injunctions when we have, of course, many other things to do. But the injunction, Fraser Health, in this case, needed to seek the injunction, and they are. And hopefully that sends a message about our determination. But of course, it's also our expectation in a pandemic that this is what we owe one another, to follow public health rules which keep people healthy and safe in a difficult time. And it's our expectation people will do that.
Shannon, do you have a follow-up?
Yeah, I have a question for a colleague. Sources tell us that staffed ICU beds are now fully occupied in the province and that there's simply no capacity left. What are you going to do about that? Are you trying to bring in more staff from outside BC, or have you asked Ontario for help?
Well, I think I just laid out, I'll give you the numbers in detail. I'll give them to you by health authority in terms of critical care hospital occupancy rates. We have 510 total base beds in our province. 136 of those are in Fraser Health. 14 are currently vacant. That's 89.7%. In Interior Health, there are 87 total base beds. 11 are vacant. That's 87.4%. In Northern Health, there are 40 base beds. 11 are vacant. That's 72.5%. In the PHSA, there are 12 total base beds. None are currently vacant. So that's obviously 100% occupancy of those base beds, although none of their surge beds are occupied. In Vancouver Coastal Health, there are 146 base beds and 8 are vacant. And in Vancouver Island Health, 89 base beds and 11 are vacant. And part of the reason, for example, in Vancouver Island, you see that high utilization in Vancouver Coastal Health is that we are moving patients from other parts of the province and other communities into those health authorities. So this is a very challenging situation. It is. Our total census in terms of critical care right now, this is all in COVID-19 and not COVID-19. I'm just doing the math here, but is 490, which is more, I think, than it was last week. I think it was, when I reported last week, about 470. So that shows what the trend is. And it's a very challenging situation. And it's, of course, in some communities, for example, University Hospital of Northern British Columbia and Prince George, which takes patients from other places, and other busy ICUs, of course, a very, very challenging situation. It's why we're also using surge beds, and that's 35 surge beds. So that's where we are. And what I'm saying to everybody is, And it's why we are reducing, and we have reduced, non-urgent scheduled surgeries to create hospital capacity. It's why we've taken steps that we don't want to take to move patients from one part of the province to another, to create and to support healthcare workers in capacity. And we have the ability to do that, of course. So what you're suggesting are not things that are needed, but I think everybody working in critical care in BC are exceptional teams who have incredible results, the best results in the world in terms of treating patients with COVID-19 and other things. What they're asking and what we're asking is that people get vaccinated. And the reason we need people to get vaccinated is that it is, in my view, and I think in Dr. Henry's view, a preventable fact that 88% of people in our critical care units with COVID-19 right now are not fully vaccinated. That's a preventable situation. We have, in total, less than 24 COVID-19 cases who are either partially or fully vaccinated today. And if that were the situation, obviously we, across the province and with everyone, we'd be all vastly better off. So the message here is we're going to continue to manage the healthcare system, to protect it and to support healthcare staff. We have quite a bit more capacity to do that should we need to take other steps. But the message to everyone is get vaccinated.
For the next question, we go to Lisa Eusda, City News.
Hi there, Dr. Henry. Just following up a bit on what Richard asked, I'm just hoping you can give a little bit more clarity about how you know it's safe. You know, you said that it's not 100% safe, that when you will allow full capacity again. So what is the limit, especially when Minister Dix is talking about how full the hospitals and ICUs are? How do you know that it's not going to backfire? Because people are having a lot of time trusting this virus and trusting the approach.
Absolutely, and we need to remember that it's the vaccine helps us, and it helps us get back to being able to do things in those settings where we can mitigate the risk. But it is not for everybody. For people whose immune systems are not strong, this is not the time to go to a place, even to perhaps a theater right now at full capacity. But we have not been seeing large outbreaks with the measures that we've had in place now in those settings where it's controlled, where people are actually checking vaccine status and where people are wearing masks and staying seated. It's not taking off in the ways that we have seen in the past, with the exceptions of some of the communities where we've seen. So last week, of course, we put in additional precautions in the north because we were seeing it. So these measures don't apply. We're not increasing capacity in events in northern communities right now where we're seeing a lot of transmission. As a matter of fact, we've put in some additional restrictions, most of which affect people who are not vaccinated, to try and reduce that risk to them and to others. But some of them do affect people who are vaccinated, recognizing that when there's a lot of virus around, there is going to be transmission at a much lower level, but there's still that risk. So it's not 100%, but we need to find that balance of being able to do those important things with the best measures that we have in place. So it's making sure that we are checking the vaccine card, that people are protected as best they can, that you're still wearing masks, that we're not gathering together in large groups. You go in and you experience it in the way that is safest for everybody. So I'm confident that where this is happening, in those areas where we have high vaccination rates, that this will be a measure that is not going to increase risk and that we'll monitor it over time.
Lisa, do you have a follow-up?
I do. Perhaps more for Minister Dix. With it taking this long to get to the injunction phase with Raleigh's, and now people are going to be allowed to move around, but they're supposed to keep their masks on indoors, and Dr. Henry saying that it works when vax passes are checked at the doors. If it's taking this long to get to where you're at with Raleigh's, how are you going to keep up with the people who are, doing half measures across the board?
We do hear, and particularly we hear complaints from communities where immunization rates are lower in the north. We've heard a number of complaints in the north, and this progressive approach has been applied in those areas, and yes, it is a challenge. But I will say that we have overwhelming support for people feeling comfortable going into a restaurant, going into the theater, going into a movie theater, knowing that everybody else there is vaccinated too. So I would say to you, be sure to let people know that you support this. Support those restaurants that are doing the right thing, making sure that we as a community are saying this is something that we do together to keep us safe. Those are the safest things that we can do that allow us to have those important things in our life right now.
The next question, we go to Rob Brown, Dawson Creek Mirror.
Good afternoon. Thanks for taking the time this afternoon. First question is there a timeline for when the province is going to be going mandatory vaccinations for children, and what does that look like?
Yeah, I actually don't see at this point that mandatory vaccinations will be required for children. I think there's a whole lot of considerations that we put into mandating vaccines, and as we've talked about a number of times, it depends on risk to the individual, but also the situation that we're in and risk to others by the protection that we have or don't have. And that's why my focus, of course, has been on making sure that long-term care, people who work in long-term care, are protected for their own protection so they don't bring things home to their families, but also to protect the other workers in that situation, and most importantly, to protect the elders and seniors we care for. What we see with children, thankfully, is that they don't have illness for the most part with COVID, and so that risk-benefit on an individual level is different. Plus, we know that some of the disruption that they have in their lives, and it's a way to try and minimize that. That is really important. It's important for growth and development of children. But this is not something that we're considering at this point. We do have provisions for unvaccinated children, for example, to be excluded if there's an outbreak for their own protection. And those are the measures that we will think about going forward. But we're actually quite excited that we'll have some way of protecting young children from getting sick from this virus, but also making sure that they can continue to experience the life that they need during this period in their growth and development.
Rob, do you have a follow-up?
Absolutely. We have a fair amount of chatter up here of, about, when the days the passports are no more, and people looking to, quite frankly, outweight the passport requirement. Is this something that either yourself or the minister ever see going away as far as, a British Columbia without vaccination passports, or is this as common now as your driver's license and your fishing license?
The BC vaccine card program is designed to address those high-risk situations, so indoor settings, in settings that are discretionary, so it's not about essential services, where we can mitigate the risk and allow people to experience those important things in their lives. But there's also alternatives for people. There are alternatives like takeout, like watching on TV, the hockey game, etc. So I don't think these are a part of our life forever. But I will say right now, with what we are seeing, not the time to game the system. This is not the time to try and pretend and get around it because you don't like the concept of it. It's about making sure that we're doing what we can to keep those people who are not yet protected from vaccine from getting sick and from passing it on to others in those higher risk settings. So this is, not, I know I've heard a number of people trying to get around these. And like all of the things that we're doing, it's not to get around it. It's to to make sure that we're doing what we can to support each other to get through this period where we are still seeing a lot of transmission of this virus. And this virus has changed. So we need to adapt our measures and the things that we're doing to keep each other protected and to make sure that we can get through this fall and winter.
And just, Rob, on Dawson Creek, I mean, the path forward. I mean, the path forward for everyone, the path forward for people in Dawson Creek and everywhere else is a higher rate of immunization. This is what we need to see. As you know, Dawson Creek right now in this period has suffered and is suffering significantly from COVID-19, from its impact on people in its community, on the impact of the, I believe, 13 or 14 people who have been flown out of Dawson Creek to be in critical care, most of them on Vancouver Island, flying 900 kilometers. We need to raise those vaccination rates, which are 67.2% first dose immunization in Dawson Creek. We need to raise those much higher. Overwhelmingly, people in the north, in their majority, have got the vaccine card. Overwhelmingly, people in the north, we're approaching 80%, and we expect to hit 80% across the north soon, are getting vaccinated. But we need more. We need more people to get vaccinated. People want, I know people want another path. Some of them want another path. This is the path. It's free, it's easy, it's safe. You can get it. It keeps you safe. It keeps your family safe. It keeps your grandmother safe and your granddad safe. Get vaccinated.
For the next question, we go to Glenn Korstrom, Business in Vancouver.
Hello. Thanks for taking my call. The daily statistics track unvaccinated, partially vaccinated, and unvaccinated people. I'm wondering, do you track the hospitalizations, deaths, and cases by brand of vaccine?
Yeah, so there's, as we've talked about a number of times, there's different types of surveillance data, and then there's hospital census data. So one of the things that we do with surveillance data is understand exactly who got what vaccine for at which time and which interval. So we presented a couple of weeks ago, and there's some very detailed information on the BC CDC website, and this is part of the data that the U.S. CDC, for example, used to help them come up with their recommendations about allowing mixed and matched vaccines into the U.S. So we do track vaccine effectiveness, hospitalizations as a measure of severe illness by what combination of vaccines people received, and that information is available. What it does show us across the board is that every combination is very effective at preventing severe illness. The AstraZeneca is slightly less than every other combination in terms of preventing infection. But if you got AstraZeneca and then an mRNA vaccine, that protection goes back up again. So what we are learning, both here in Canada, with data from Quebec and from BC being really important part of that, but also from around the world, is that the interval between dose 1 and dose 2 makes a difference in how long and strong your protection is, and that's something that we went to a longer interval early on here in BC. And also the different types of vaccines that you have can stimulate the immune system, and the mix and match can, in some cases, provide a stronger protection. So these are all things that is what I call science in action, that we're learning as we go about how these work. But yes, we do have that information. It's an important part of how we measure things over time, and how we know when the effectiveness might wane for people, and if and when a booster dose might be needed, or a third dose, depending on people's immune systems and things.
Glenn, do you have a follow-up?
Yeah, and so I'll check the CDC website for the brand of vaccine, but some other data points. Like the daily stats don't have third doses broken out. It's just first and second doses. And then also I'm wondering about the number of people in hospital with COVID-19 related ailments that are not in the regular numbers. You said a couple of weeks ago it was about 140, but I haven't had updates. So that would be the people who entered hospital for something else and caught COVID in the hospital, or who went into hospital for COVID and have gone more than 10 days.
Yeah, so it's, and I did say that we were going to be providing that number. As it turns out, not surprisingly, perhaps it's more complicated than I initially thought. So I've been working with our team, and we will be trying to provide a semblance of that. So what we do measure, we measure the number of people with COVID, and what we want to understand is how many people who've been diagnosed with COVID end up at some point in their illness in hospital. And we only want to count them once so that we know what percentage of people have severe illness or hospitalization. We also want to know how many people end up in critical care. On the other hand, we also are following how many people are in hospital with COVID, and that is a different question. It's about capacity, and the minister presents those data on an ongoing basis. And some of the people in our hospital census are people who've had COVID and are no longer having an acute illness. So it's not an automatic at 10 days. It depends on the person's illness. If you're in ICU, you may not be considered recovered from that acute illness for 30 days or longer. It depends on how the course of your illness goes, even though you may not be infectious anymore. So in what I am learning is that marker that we've put in to help the hospitals manage staffing in different units. So the information is collected not for us to understand how many people are recovering in hospital, but for hospitals to manage operations. So, which is all to say, I'm trying to get a better sense of what that number is. From the initial look at it, somewhere around 200, we think, but that includes a variety of things. It includes people who are over their acute illness and are recovering in hospital, and we're looking at how many those are. At least a third of the people that we're talking about are people who were in hospital, discharged more than a month earlier, and have come back into hospital sometimes for complications from other illnesses or for other reasons that may not have anything to do with COVID. So we're trying to sort that out. Some of it are people, as you mentioned, that are in hospital, get COVID while they're in hospital and then are still in hospital. And some of them are people who have recovered from their acute illness but can't go back to living at home. So they may be awaiting placement, for example. So I am working on trying to get that, and I do apologize that it's taken longer than I expected, but it's a reflection of the fact that we don't have a simple single IT system that allows us to look at this in an easy way, and so much of this information is collected one-on-one by a designated staff person, usually a nurse, over time. What I can tell you is the ICU numbers, are the critical care numbers, are collected by an individual in those critical care units, and there's a smaller number of those. So those have been steady over time and more consistent. And I will be coming, hopefully, within the next day or two, with a better breakdown of what we're talking about in those that other group of discontinued isolation. I will also say that one of the complicating factors that we've had is when the cases dramatically increased in interior health this summer, there was a period of time when some of that census taking in hospital was not, it was missed. So we're looking at what that means, and we'll be correcting that number. All of those people are counted in our cases of people who've had COVID, but there's some people who the hospitalizations have been missed. And we're working on what that means and how many of those that there is over time.
Yes, on your first question, Glenn, we'll be breaking down, I think, starting tomorrow, the day-by-day of third doses. It's roughly 60,000 across the province. There are three categories of people currently eligible. From quite a bit further back, the first 15,000 who are extremely immunocompromised, and that group of people is well under their way to have received their doses. They were invited to book appointments, to get appointments in the middle of September. The second group are people in long-term care and assisted living, and we're making, I think, significant progress and will in the next this week and next week to meeting that test for residents of long-term care and assisted living. And then the third group are about 110,000 people who are not as immunocompromised as the first group, but significantly immunocompromised. And they've been invited, people such as cancer patients, for example, and they've been invited to book as well. So of those categories, about 60,000 have been done, and we'll start reporting on third doses, I think, tomorrow, as we have first and second doses through the time. I would say in the past 7 days, there have been more third dose immunizations than first dose, as you'd expect, given that we're now at 89.2% of first dose immunization. But we're obviously pushing people to get first doses to complete their course with the second dose. And where eligible and required, based on being immunocompromised, or the protection we're providing to long-term care in those settings as well.
And our final question today goes to Belle Puri, CBC.
Hello, and just a reminder, please, we'd need our answers both in English and French. The vaccination rates among Indigenous youth are low compared to their elders and non-Indigenous youth across BC, and it's voiced the need for better vaccine campaigning to address this issue among Indigenous youth. How will the government work to improve vaccine messaging and outreach to urban Indigenous youth?
Yeah, that's a really good question, and something we've been working on a lot. Dr. Danielle Bain-Smith in my office, and particularly Dr. Shannon McDonald with the First Nations Health Authority. As you know, we've been linking data for First Nations and other Indigenous peoples from the very beginning of this, and that information is housed and used by the First Nations Health Authority. And these are some of the things that we're seeing. We saw a really strong uptake early on. We prioritized a number of First Nations communities, and we took an all-of-community approach, which means all of the adults. And in those communities at the time, of course, it was only 18 and or 17 and above who were eligible. So we saw real strong uptake early on, and then it's leveled off. And it's also a challenge because the proportion of younger people in those communities is higher than in many other communities. So there's still a higher proportion of younger children who are not yet eligible. And it's been a challenge getting vaccine for the 12 to 17. A couple of the issues have been, much of the early immunization in communities, both urban communities or near urban centers as well as remote communities, was with Moderna because it was more flexible from a logistics point of view and didn't need quite the same level of freezer stable time. But of course, the Moderna wasn't approved for use for younger children for considerably later than Pfizer. So going in with when the whole community got Moderna and offering Pfizer to younger children the teenagers was a challenge in some communities. And of course, there's been some pushback in some communities about people being concerned about the effects of the vaccine. And we've been meeting with First Nations leaders to try and get ideas about how we can do this better, how we can make it safer for young Indigenous people to get the vaccines and to get them as quickly as we can. So these are not easy questions to answer. We are certainly looking at it, and especially now we've started to see increased rates in First Nations communities. We have about 7 times increase now compared to non-First Nations communities in some areas. So it is an important question. And some of the specifics we're doing, I point you to the First Nations Health Authority website. There's some great information, but it really is about trying to tackle it on an individual, community by community basis, having those trusted leaders answering questions for people. And I've had the spending many hours over the last few weeks with leaders across the province to try and come up with some strategies for that.
I think, Belle, certainly from the 12 to 17 population in the north, for example, we have around 50% 2-dose vaccination in the 12 to 17 category. And within that category, you see the same kind of regional variations in the north, in Indigenous communities in the northwest as opposed to the northeast, that you see in the overall population. So we're working both locally and with First Nations leaders everywhere to raise those rates, because that's extremely important. Early on in the pandemic, we gave priority to Indigenous communities, and we got to a certain level. For a long time, those communities were the most vaccinated communities for those reasons. But obviously now, we are now many months since it was offered, since COVID-19 vaccine has essentially been offered to everyone in that situation. While there are regional differences isn't borne out, and that's why we're making, and the First Nations Health Authority ourselves are making significant efforts to try and expand that and to raise those rates now. Je dirais en français que pour les communautés des Premières Nations, ici, il y a une grande variété de niveaux de vaccination. On travaille fort, mais il est vrai que parmi les jeunes, surtout dans certaines régions, le niveau de vaccination est beaucoup moins élevé qu'ailleurs. Donc, en général, dans le Nord, par exemple, seulement 50% ont reçu 2 vaccins maintenant, de 12 à 17 ans. Et la situation parmi les gens de Première Nation dans la région est de même. Et les variétés régionales aussi, entre le nord-ouest et le nord-est, sont équivalents à la population en général. Donc, on voit ça dans le niveau de vaccination. Donc, c'est très important. Si on est dans une communauté isolée, par exemple, la risque, on risque maintenant de ne jamais vu COVID-19 et puis de le voir d'une manière massive d'un moment à un autre. Donc, c'est nécessaire d'être vacciné. Dans la région urbaine, on voit un peu la même chose et on travaille fort avec les organisations, avec le First Nations Health Authority pour soulever cette campagne, pour augmenter les chiffres, mais aussi certainement pour assurer que les gens des Premières Nations sont protégés contre le COVID-19.
Belle, do you have a follow-up?
Yes, please. How many children aged 5 to 11 in British Columbia have already been registered to be vaccinated? You know, we're wondering if you can elaborate on how you plan to roll out the vaccination program for children. You know, will the vaccine be available at the same time across the province, or perhaps certain communities targeted first? Looking for an update on, you know, also where children will access the vaccine.
Well, I can give you the generals. I know the minister has the numbers on the number of people who's been registered so far. We have about 340,000 children in the 5 to 11 age group. And we know from polls that have been done, I know there was one that just came out yesterday, that shows about half of parents, a little more than half of parents, want to have their children protected as soon as possible. So that's good news. And I know it's something we've been waiting for to make sure that we can support young people. And how we're going to do that will vary, and those details are still being worked out. It will vary by community. We expect that we will have enough vaccine to have it available everywhere in the province at the same time, but it will be different strategies depending on the community. We're talking, for example, in some of the more remote communities, we may do it at the same time booster dose for certain people in that population. So these things will vary depending on what, how the community would like to access. I will say that it will mostly be done by the immunizers that are experienced in providing vaccine to children in clinics, and so very specific family-oriented clinics in many communities, for example. It will not be largely through pharmacies or family physicians' offices to start with, because we need to continue to ensure that every dose gets entered into our IT system, and so we're looking at ways to facilitate that. We need to have every dose in our immunization registry. That, the 8 million plus doses that we've had. It's what allows us to show the effectiveness and the safety of vaccines, knowing exactly which lot number of which dose has gone into each individual's arms. And we talked earlier about how do we know vaccine effectiveness by different brands of the vaccine, and that's because it is so important when we have new products like these that we measure that so fastidiously. So our IMS BC program has that ability, and we are onboarding pharmacies to be able to provide that. But we also hear from parents that they want to be with their child. They want to be able to be in an environment that's supportive for children. So we're working those details out, which sounds it will. It's hard to describe because there's going to be different ways of approaching it depending on the needs in different communities.
Yeah, we'll get the number of registrants. I had it from a few days ago, but it's been going up obviously because now we have a situation where Pfizer, of course, is seeking approval to move forward, and we have some high expectations that we'll be able to move forward and start immunizing children soon. So I think the numbers on the move. One of the interesting things about, and we're learning the lessons from the 12 to 17 vaccinations, which are going very well. They're well over 80% province-wide, but 12 to 17 still lags other categories. And if you look at the specific numbers within that, we understand that 17-year-olds and 16-year-olds and 15-year-olds and 13-year-olds and 12, you'll see a drop. So 17-year-olds are much more than 18-year-olds, 18 to 24 being over 90% in terms of immunization. And each time you drop an age year, we have a lower level of immunization. So we're learning the lessons. We're going to talk to people in terms of how we're the most effective, because as Dr. Henry said, that's 340,000 children eligible approximately for the vaccine, and we want them to be able to get it and to meet the particular problems of getting a vaccine and getting a needle when you're a child, and all of those are real, and we're going to work our way through that. So it may look a little bit different. We're going to look at the situation and see how we can do it best. Je dirais en français que, bien entendu, il y a des enfants de 5 à 11 ans qui vont recevoir pouvoir recevoir un vaccin de COVID-19, et ça c'est important et essentiel. Et donc on travaille fort actuellement pour enregistrer des enfants, mais il y a beaucoup d'opportunités. On n'a pas perdu votre place en attendant. Il y aura beaucoup d'opportunités d'être enregistrés et de recevoir ces vaccins-là. On va aussi apprendre les leçons de ce qu'on a vu pendant nos efforts de vacciner les gens de 12 à 17 ans. On voit que les gens de 17 ans ont un niveau de vaccination beaucoup plus élevé que les gens de 12 ans. Et on va travailler fort avec les parents et les autres pour assurer la réussite de cette campagne. Mais bien entendu, on est ravis avec cette opportunité, et on va travailler fort ensemble pour assurer que c'est une réussite aussi. Merci beaucoup. Thank you very much.